Thank you. I'll touch on 4 areas today. First of all, the hospital. It feels really quiet, actually. There's a sense of sort of waiting for things to develop. And anyone who's been there, and most people have stayed away, thank you. But anyone who's been there will know it feels a very different place to how it felt 2 or 3 weeks ago. I want to emphasize the hospital is there for people who need it, because we're seeing some people presenting perhaps later than you would hope with things that we could have helped them with. And if you think you need to attend the emergency department, if you need medical help, we are there for you. It's not closed to all business, and please don't wait for your symptoms, for your conditions to get worse before you seek help. If you need help, please come to us. So the hospitals feels like a sort of poised, ready for action place at the moment. We only had 5 patients in our suspected COVID ward this morning, and 2 of them we're hoping will go home today. They may have gone by now. So that's the hospital. The care homes are really the front line for a lot of our population at the moment, and we just want to say that for a couple of care homes where we know there's been issues, we're doing all we can to support these homes, because it's a big challenge. So we've been sending staff to help out, PPE provisions. Primary care have allocated a GP per care home, and there's been lots of input there in terms of getting care plans in place for everybody in the home, and that's all going ahead. But we know that people are working under difficult conditions there, and we're doing absolutely everything we can to help in that position. Personal protection equipment. We've touched on it. There's a worldwide shortage. We have supplies of everything in stock. We completely adopted the new NHS England guidance for personal protective equipment for hospital staff, but not just hospital staff, right across the board, staff in care homes, pharmacies, ambulances. The guidance is really helpful. It's clear. People can see very clearly from the tables what they should be wearing for what sort of patient, and we are fully supporting them in doing that. So we have the equipment that we need. We're using it really carefully. We're keeping close control of the stocks we've got and allocating it to places as they need it. We have huge amounts of orders waiting still, and we have equipment in all areas. So we're content with our position, and we're keeping a close eye on it. I think those are the things I really wanted to touch on today. Thank you.
Great, thank you. Just one question on the PPE, which comes up frequently, is a lack of understanding of why there is different PPE in different environments.
Yeah.
Now, you've touched on it before, but I think it's worth just explaining again that actually what you may use in a care home may not be the same as a hospital. Why is it different?
Absolutely. So the guidance for the guidance that the NHS have published it's best summarised in the tables. If you want to hit their website and look at the tables, it's really clear, because they tell you for a known COVID patient that you have to be within 2 meters of, you must wear your apron, your mask, your gloves. Those are all ticks in the boxes for those things. If you're doing anything that generates aerosols, and for example, that might be if you have to do airway work, or induce physiotherapists might have to induce coughing, that sort of thing, they need to be wearing different types of masks and full-length aprons, and that's all described, who needs to do that. But for patients where we don't suspect COVID, we're taking normal precautions, and again, we've got a difference between suspected and positive COVID patients that's clearly described in the tables. So we just ask people involved in healthcare know about this guidance, use the charts, use the PPE that's appropriate for what you're doing, and we'll make that available to you.